So I finished treating her with the Hesch method, a method I developed for the evaluation and treatment thereof. And it took me 5 minutes treating both sides of the pelvis. Before I show you what her presentation is, I will add that there was some counterintuitive findings that I had to override and let the body speak to me and tell me what it was doing and what it needed. And in the end, everything came out and makes sense. I'll come back to that when I demonstrate the positioning of the sacrum. So can you give us some feedback?
Yes, I feel like my whole pelvis has so much more space and feels so much lighter instead of feeling this compression that I normally feel, especially around my bladder. And also I just went to the bathroom and urinated, and I feel like I am urinating through a much bigger, more normal opening versus a constricted urethra. So I'm feeling very positive about that.
And then when you walked, did you have a chance to sit in the chair?
Oh no, I didn't do that.
Yeah, let's move the camera angle to the wall maybe and have her sit in the chair.
No.
Yeah. And can you describe anything you might have felt walking?
Just my hips are rotating better when I walk and moving better with me.
And when you say hips, do you mean pelvis?
Pelvis.
Okay, all right.
Just feel a lot less compression when I'm sitting.
Where would you feel that?
I normally feel it over my bladder.
Okay, all right.
Just
okay.
feel like my pubic bone is more open and it's giving space for my bladder to live and to move around and not, feel. I mean, usually sitting is not a good position for me. It makes me
Okay.
wanna
And I would submit that this is something that fascial work, visceral work could not release.
Yeah, it would just temporarily do that.
And I would also submit that this is going to be long-term lasting.
Yes.
That you would need a large force insult to undo my work.
Yes.
This is a once and done.
Yes.
And if I'm wrong, I'll admit it, but most of the time the body embraces correction. The body likes correction. It doesn't like it doesn't like a lack of normative micromotion, but it doesn't know how to bring that back sometimes. So those are the unresolved injuries that I see.
Yeah.
Let's have you lie on your back and we'll show what we find on the front and then on the back, okay?
Okay.
So we measured the depth of the fibrocartilage, being extremely careful to be precise in that, and we now measure 2.5 millimeters, and we had 5 millimeters before that, okay? And then just visually, it's symmetrical. I'm pushing equal force. Do you feel an equal force in my thumb and finger?
Mm-hmm.
Okay, and they are in the same plane. And now I'm going to go to the mid portion of the pube, and it feels less dense. Okay, now I'm going to take up the slack right there, and then I'm going to spring it. And it has that tiny spring and recoil. And it shouldn't have much. It really shouldn't. Lie on your stomach.
And it's also less tender than it was when you first started a few minutes ago.
Very good. And your sacrum now has a more posterior orientation. That's your norm. That's the factory setting. Okay. And now, when I do a PA load at S123, there's the load. Okay. There's the spring and the recoil. There's coccyx. Here's ILA. Okay. And right here is sacrospinous. Tell me what that feels like when I spring it.
It feels like it has more tone now than it
More
did.
tone. That's exactly what I
Yeah.
feel. And then sacrotuberous should be in here, so right there. And when I spring it, how do you feel?
It feels like it's has more tone in it.
Yeah.
It's more elastic too.
Yeah, it's a stronger ligament.
Mm-hmm.
So, no, your lax ligaments didn't need gobs and gobs of strengthening. It didn't need a support, a pelvic belt or any of that stuff. Surgical tightening, right? It needed normative mobility restored throughout the system, starting at the place where it was most restricted, which required a little bit of clinical guesswork. But with clinical experience, I went right to what was needed and did it, and it worked. So quite an interesting case. And it just motivates me to, to move forward with the next course that I spoke of. Any final words?
Well, you know how I also came in with a lot of thoracic pain in my ribs, and it has lessened by doing what you just did.
Wow, that's fabulous. That's wonderful. You were very hypersensitive in the thoracic spine, especially mid-thoracic and along the rib cage.
Lots of pain, and it has subsided.
That just validates that you can quiet the nervous system at a significant location and have distal effects, or you're at least quieting the nociceptive input in the spinal cord, and so other nociceptive inputs, I don't know, maybe more relaxed. I think of Core's facilitated segment work in the 80s, and it's been redescribed in other languages, but I think I've said enough on that. Guy, do you have anything to add to this? Oh, your labor had to be induced after 15 minutes. 15 minutes.
I
After
wish.
15 hours, you weren't progressing.
Correct. Yeah.
And your husband yelling you didn't help you progress.
Right.
So you had to resort to a C-section.
Right.
Guy, any thoughts?
No, it's just very interesting to see the systematic approach to analyzing normal body function and then working where the abnormalities are found. Doing the work and reassessing seems very straightforward, honest, and obviously yields substantial results.
Yeah, it measures that property, that elastic property in all connective tissues and bone and joint. And just to kind of wrap this up, I have been doing whole body work with you. We've worked top to bottom. You want to just comment on the bone deformation work I did in your tibias and femurs?
Yes. So I had never had any bone deformation work done, mid shaft, and but it turns out like a lot of my knee problems were caused by rigidity and restrictions in planes of motion along, especially my tibias. So I'm definitely a believer in that being very worthwhile work to be doing, because I also came in with knee pain, and that has resolved a lot.
We also had to bring your fibulas back inferiorly, restore
Correct.
that inferior glide mobility.
Correct.
And that further helped the knees as well, right?
Yes, definitely.
And we worked on feet.
Yes.
Well, I think we'll wrap this up now, and I sure thank you, and we'll be in touch, and you'll let me know, long-term how you're doing.
Yes.
And you've taken my lumbopelvic hip course, and you're about to start the whole body course,
Yes.
right?
And yeah, your lumbopelvic course is awesome. I recommend it to anybody. And I'm excited to get started on the whole body.
And how do you compare the lumbopelvic hip course to what you've learned prior?
Well, there have always been a lot of missing elements in my learning, I feel, even though, I did manual therapy and PT school. I really, really think that it is.
Yeah, you went to a school that was very strong on that, right?
Yes.
Yeah.
And, you know, I really, really think that it is so important to feel the recoil of the bones as well as the spring. And it only makes sense. I mean, that's the, you know, the opposite range. You know, you should want to feel what that recoil is doing as well as the, you know, the springing. So, and I've already used it on several of my patients, and it has really, really helped with various problems.
Is it easy for you to find the restriction?
It's, you know, I'm practicing, but you know, I'm getting better at finding the restrictions, but it pretty much is, because if you just ask yourself, what is the obvious motion that is not, you know, that is not moving, it pretty much comes to you if you know, if you don't complicate it with different grades of, well, is this moving this much?
Yeah. What is the Hesch grade, please?
1.
Yeah, is it stuck?
Yes.
And stuck has a distinct feeling. If I push against this cabinet, it is stuck. And yet, if this drawer is fully closed, well, it's stuck too. But sometimes on a door, you can close it a little bit further. That's an elastic property.
Right. And that really, you know, that really helps, because you can really narrow in on the major problems. And a lot of times my patients will give me feedback and say, yes, I definitely feel that.
Yeah. And it's inextricably linked with the nervous system. So this really is a nervous system approach, not a move bones approach.
Very true. And it's also, you know, because you're, you know, looking and listening to both and being aware of both, you're listening more to the patient, what's really going on with them, being more in tune.
That's a novel concept.
Mm-hmm.
No, it was Hippocrates that said, physician, listen, for the patient is telling you what's wrong.
Yeah. And
I experienced that problem more than 2 weeks ago. 2 neuropsychiatrists denying me my right to have an exam and coming up with their own theories. Just, you know, we have big problems here. Let's stop here. Thank you.